in just a moment what that is, but I think in its simplest terms, what we do at Fairview and in well over 100 other facilities is we provide interventional radiology and endovascular and vascular services to the buildings, and that sounds
tell us
that doesn't sound so
what exactly does that mean?
That doesn't sound so interesting, but it actually is quite interesting. We do things that with our hands quite a bit. So you might have other services like a cardiologist or an internal medicine doctor, and he or she does really critical work. Every once in a while there's a need for somebody to get a surgical maneuver or a procedure, and the goal always is to do it as minimally invasive as possible. And a lot of what the field of vascular interventional radiology does is we do a lot of things in a very minimally invasive way. So especially patients like the ones we have in a nursing home setting, they get the treatments they need and are ahead of problems or treat problems in a much more effective way with less invasiveness. We really don't want to make large incisions in our patients if we don't have to.
Right.
We'd rather solve things with a scalpel as opposed to a chainsaw. And that's generally what we try to do.
So in English terms.
So in English, again, in Forest Hills, it's I think the most diverse location in the country. So we'll stick to English though.
All right. So basically,
but that being said, we treat a lot of things like vein disease. So people have problems with their veins in their legs or arteries in their legs. And these things can cause a variety of issues. Of course, the most well-known are things like wounds and infections in people's legs. Certainly things like blood clots. So really scary stuff that we really see a lot of in the nursing home setting that we can be ahead of. Some of the things we do are as complicated as peripheral arterial disease, where there's blockages in arteries or narrowing, and we have to actually open them up more so that more blood flow can get to somebody's extremity or their leg. But even simpler things like varicose veins and venous insufficiency are things that we can actually treat as well for patients.
So you created a company that actually works in one of the facilities, like Fairview, for example, where you cater these services to these patients, helping them with these type of issues. Now, like we said in English terms, specifically with different type of diseases, in feet specifically, right, with veins, this is something that you work on, you help treat that.
Yeah, it's really common. People get blockages in the arteries of their heart, in their brain, and things like heart attacks and strokes. And that seems to be very obvious to people, because we all know about it. But what's really almost as common, if not as common, is things like blockages in different arteries, whether it's your renal arteries and your kidneys, but really importantly in a nursing home setting in older patients in their legs. And that's where we see unfortunate things like amputations, wounds, and that could be from the veins, from the arteries, either not flowing well enough in the veins or not enough.
What is something that causes varicose veins?
So, varicose veins is one thing, and I want to get to that in just a moment. It's an excellent question. But, a bigger issue when we talk about veins and arteries in this setting is actually arteries. People's arteries get clogged and blocked. And why does that happen? Well, that happens because they smoke, unfortunately. We really have to, as a society, we've gotten better at that. But smoking still is pretty pervasive.
What do you say about vapes? That's like the new craze, everybody's vaping.
What's interesting about vapes are, a lot of the, certainly the carcinogens or the extent of them, and even things that are caustic or detrimental to arteries or veins, probably, and this is a probably because we need more data, are probably less prevalent in vapes. Okay, and they're even, some people even think they're more fun or more safe. But certainly, but I certainly wouldn't call them safe. Cigarette smoking, we know a certainty. Increases the risk of arteries getting blocked, increases the risk of things like strokes, even bladder cancer. So people who smoke are just at very high risk for these type of issues to happen, and we catch these people later in life when you can't really compensate as well for those issues. So if your arteries are blocked, it becomes a really big issue when you're older, and then you have threats of losing your limb and others that are very scary. But things like diabetes, diabetes is a really prevalent disease as people age in our population. We're not also great with our diet and exercise. I'm certainly not as good as I should be. And, that causes some of these...
Me too.
No, how are you talking about? No.
So you're saying
it's all muscle.
It can't...
So...
I know, right? Look at these guns.
Yeah, exactly.
So it can be passed on, the family history. If somebody, the family has diabetes and it passes on, that's something that can...
varicose, that's correct. Varicose veins tend to be very genetically inherited, and there's a very strong predisposition. Varicose veins or venous insufficiency is really the most right way to really talk about it clinically. Varicose veins tend to be some of the manifestations we see if somebody has bad or insufficient flow in their veins. That's a different issue.
Do you see that primarily with age? Like if you hit a certain age, that's...
So it's a very good question. It's very common for people to have venous insufficiency or varicose veins. It's a little more predisposed to women than men. The problem really is not so much that it happens more when people are older, which it does, but it's also about the ability for the body to compensate for that as you get older. So while somebody with varicose vein at a younger age may complain of itching and discomfort, and certainly needs to be treated, even cosmetically they might see manifestations that are unseemly to them. It's actually a big issue medically when you get older. You know, that stasis, the fact that the blood is just sort of pooling and in those very highly pressurized veins, they could open and they can bleed. They can cause things like blood clots.
I actually saw a video recently. This person went to the doctor to get rid of their veins. I mean, cosmetically, and they got one shot, and in the second you see those veins just disappear. What are your thoughts about that?
That's so interesting. You know, we don't necessarily get that type of satisfaction always with our patients here because we're not treating cosmesis whatsoever. You know, people tend to mistake varicose veins often for reticular or spider veins, and you know, the cosmesis there is something you can treat. We just don't do that in this setting. It's not what we're trying to be ahead of. Here we're trying to be ahead of things like DVTs, cellulitis, wounds, and work synergistically with the wound teams to actually give alternative and really the right pathways to get certain things treated.
So a person, obviously a person who's not educated in this field, you know, a vein looks like a vein, but you know, for you, it's all the veins are so different. Like you said, the spider veins are different. It's not necessarily...
and there's different types of veins. You know, we talk about things like blood clots. We're talking about what's called the DVT, or deep venous thrombosis. So that happens and actually occurs in what's called the deep system veins in your legs. And that's totally different than the superficial veins in your legs, which causes things like varicose veins. So, you know, we treat deep system veins also when there's problems with the deeper veins in your legs. That tends to be a little bit more sophisticated in terms of how we treat it. But a big thing I didn't touch on, obvious, not only do we come here and do diagnostics and treatment, and we develop a rapport with our patients, and certainly here with the administration and even the clinical team. We have outpatient surgical centers as well, where we can do more sophisticated work that can't be done within the four walls of a nursing home.
So if they get discharged, you can.
So not just for discharge. When they get discharged, of course, we follow our patients. We really take responsibility for them. But it's more about here. You know, if a patient needs an IVC filter, who's going to place that? Do we need to rely on the hospital services, which are more difficult for the patients first and foremost, more expensive way of dealing with that patient's clinical need? That's something we can do in our outpatient surgical setting. Same thing with angiography and even some veins. So it allows for a circuit to be created with the patients and the residents here. It means we don't have to send patients to the hospitals often, and we don't have to let problems manifest. And it tends to be very beneficial for patients and their families.
When does a person know that they need to reach out for medical advice?
So it's a very good point. I mean, what I like to say is there are some obvious ones, right? When you see a problem, you need to have that fixed. Obviously, like everything else, we want to be ahead of those problems. So if God forbid, you see somebody has a wound in their leg, they have terrible pain or claudication and swelling in their legs. There's very likely, or very possibly, a partial factor there is either veins or artery disease. And a specialist should take a look at that and see what upside we can get.
Is it a fair question to ask how it's treated?
Sure, of course. I mean, it would depend, of course, if it's venous or arterial. And the first thing starts with getting it brought to our attention. So, a primary doctor or a nurse practitioner or PA that's in the facility, or if there's, mechanisms in place and policies and protocols, they get it to our attention first. Once it's brought to our attention, we try to parse out, is this a venous issue? Is this an arterial issue? Is this none of the above? Sometimes, for example, edema or swelling of your legs can be totally unrelated to the vascular issues. So, we sort of take that responsibility on ourselves to figure that out and then direct the patient to the right way. Even in veins, if it's superficial, it might be things like injections that are super easy to do on site and really give some patients some relief.
So I'm assuming...
But it can be as complicated as a venogram, which again isn't too complicated, but again you need the right people with the right set of skills.
Is it painful, the recovery?
Right, that's an excellent question as well. The answer is not really, no. That's one of the goals behind the wisdom at what we do in the field of interventional and vascular interventional radiology. Everything we do is really with a pinpoint precision. And we use actually machines. We use things like AI and even sophisticated imaging. So we can see into the body with just a small hole and do what we need to do and watch on the screen as we do it. It's very cool.
It sounds very cool, and it sounds like a very specific field. What got you into this field?
Yeah, I always so I come from a long line of clinicians and doctors.
Look at that.
Oh, yeah. So my dad's actually a surgeon. He's a urological surgeon.
So you had no other choice. You had to become a doctor.
Yeah. The doctor was sort of, numbers 1, 2, and 3 for choices.
All right.
And there was no 4, 5, and 6. So, then the question was what kind of doctor I wanted to be. I always liked working with my hands. I liked the idea of being able to solve problems with my hands. And to some degree, cognitive skills. I did like to get some degree of my thought process and brain involved. But I was really partial to procedures and surgical intervention, and there really isn't a field that's more concentrated on procedurally oriented and also advancing how we do procedures, making them more amenable to patients than IR. And I was just very strongly drawn to the combination of minimally invasiveness, surgery, and technology.
Wow, I'm your parents must be proud.
Sure, yeah. My mother wanted me to be an MBA.
All right, but
she's the only Jewish mother we're aware of. I'm not proud of her son being a doctor.
All right, so we're honored to have you. By the way, and for coming out, I know his schedule is crazy packed. This was really difficult to get you, but thank you so much for making some time. And,
of course,
and
it's my pleasure to be here.
So, by the way, is insurance covered by this? Does insurance cover this type of procedure?
Yeah, I mean, it's not just this type of procedure. Like I said, it's a wide variety of what IR can offer. We do anything from G-tube management and placements, all the way up the gamut to revascularization with angiograms and stent placements. Even things as simple as PICC lines. So, the answer is everything we do goes through the insurance system. We're a conventional medical practice. We don't aim to do anything outside of the bounds of conventional medical practice and protocols. So, therefore, everything we're treating is a legitimate medical need, and that's the only things we treat. We don't come to nursing homes or adult homes or assisted living with the aim of cosmesis. Yeah, it's just not necessarily what people are interested in. And our mission as clinicians, physicians, nurse practitioners, and PAs, we're there to treat medical disease. So, of course, it goes through the variety of medical channels and insurance.
So, I mean, of course, definitely medical attention is the most important.
Sure.
Obviously, safety is the #1 priority. But also, there are people that want, especially, summer season's coming out, and I'm not, all bodies are valid, but sometimes people want to feel more comfortable, wearing shorts or going to the beach or whatever it is. So that's something that they can also even get consultation about. Right? Is that
so? What I always say is, and I said this to Avi because he's asking, Avi, you're going to look great in a swimsuit.
Thank you so much.
I don't think
no worries for me, right?
I was drawn to your legs as soon as I walked in here, so I think you're going to be okay.
Not only a doctor, but a comedian too.
I tend to say that you're asking the right questions. It's certainly within our wheelhouse to treat people that have cosmetic concerns. I just don't get as motivated or as passionate about that. There's nothing wrong with physicians and nurse practitioners treating cosmetic disease. It's something we're certainly willing to take consultation on and speak to our office and set up an appointment. But I'll always tell you, I'm just more motivated and more driven by treating people's real problems. I really am. And it's in a place like Fairview where we take, or Fairview takes on some very complex patients with a lot of moving parts, let alone the social aspect of it. There's also a clinical aspect of that. And, it makes it exciting to come to a place like Fairview because we tackle a variety of clinical scenarios. Just the other day, we were handling a catheter-directed therapy, which is things like nephrostomies and cystostomies and
sounds intense.
Yeah, it is, and we're very happy to do it. And allowing a good service like an IR service and a vascular service on board, sort of takes the burden clinically off and allows us to take in those patients and have a seamless way to treat them.
Interestingly, actually, I was able to observe. I don't know if you know this, but I was able to observe some of your staff working with the Fairview patients, and I just want to say, they are super. I'm not saying it's just to fluff your feathers, but they are really, really professional in the way how they really want to hear. It's not all about we're here just to treat you and send you off. They want to make that relationship, establish rapport, making that connection, and I very much believe when you have that relationship with a patient, it very much works hand in hand with actually helping them with whatever it is, specifically whether it's with their veins or the
that's really important. And you're touching on something I think is unique to our practice. What's unique to our practice is we really, and you see me almost dissuading you from certain types of clinical scenarios. We're a practice that just is geared and armed to treat patients in long-term care settings. We do treat some outpatients. We deal with them completely separately in a completely separate set of operations because we don't really want to merge the two. The needs and services necessary for an older geriatric patient and a younger patient, maybe with similar class issues like varicose veins, different set of urgency and a different set of systems involved.
Do you usually have younger patients?
So we do. Again, not merged together with geriatric population, even the same day in an outpatient setting, because there really are, again, different needs, different flow, and different culture that's needed for patients on the outside. So, it tends to be less of our focus as a practice, but it's certainly something we can tackle and something we do tackle in 2 of our locations. So we're very interested in treating patients like that. But again, in a geriatric setting like this one, there's just so much good work to do.
Wow. Can you give all the viewers a way to contact you, some more information, if they want to learn more about this, where can they look? Your website?
Sure. I mean, our website is really, really nice, and you'll see some familiar faces.
Oh, I saw the video. Beautiful video. Make sure you check it out.
MVPmedgroup.com.
We're also going to attach it to the video.
That's our website. You can certainly get a lot of information there. Our contact will be there as well. Our central office is also listed there. It's 516.
On Instagram, check it out on Instagram, of course.
In Instagram, we have more followers than you, so we're on there as well.
This guy. But
you know what? It's not just quantity. We're also quality. No.
Thank you so much for joining us today.
Do we have any special visitors or any administrative
people? We absolutely
I heard some rumors.
We will be having some special visitors coming very soon. So stay tuned. This is part 1. Stay tuned for part 2. Thank you so much for being with us.
My pleasure. Really.
Take care, everybody.
You got it.